Many of you have been diagnosed with glaucoma or have a family member who has glaucoma. Glaucoma is actually a very nebulous disease. It's difficult for people to understand, but I'll take the next couple minutes to try and help you understand it better. The eye is a hollow structure and it's filled with a liquid. The liquid keeps the eye inflated, kind of like a water balloon. The eye is supposed to have a normal pressure, and that pressure is between 10 and 21 millimeters of mercury. If the eye pressure gets too high, it causes damage to the optic nerve, which connects your eye to your brain. It's like the cable of your cable TV. If the cable gets damaged, then your vision starts to decline. There's two main types of glaucoma. There's acute angle closure glaucoma, and there's primary open angle glaucoma. Angle closure glaucoma is very rare, but causes extreme pain, blurred vision, nausea and vomiting within hours. And if it's not treated within a day or two, leads to permanent blindness in the eye. The only way people are going to know about this disease ahead of time is if they have a family member who's experienced it and they've had a screening examination by an eye doctor, or if they've had intermittent symptoms where they had this issue for an hour or two and then it went away on its own. That's easily treated with a laser into the iris, which is the colored part of the front of the eye. It's a painless procedure. It takes just a few minutes, and it cures the disease. Most people who have glaucoma have primary open angle glaucoma, which develops slowly over many, many years and doesn't give symptoms until it's almost completely blinded a person. Glaucoma is a treatable disease, and the only way it can be caught typically is by a routine eye exam on an annual basis. If somebody has a primary relative with glaucoma, they're much more likely to develop glaucoma themselves. Typically, once people hit age 65, they should have an eye exam every year. If you have a family member with a history of glaucoma, you may want to have eye exams much earlier than that. When you develop glaucoma, you slowly lose your peripheral vision unless you're treated. Those treatments are threefold. They typically start with an eye drop once a day. They go on to numerous eye drops a day. If the eye drops aren't working, we can do a painless laser procedure. And if the laser procedure doesn't work, you actually have to proceed to surgery in the operating room to lower the pressure. Some people with glaucoma can develop pressures as high as 60 or 70 if they have an acute attack of glaucoma. But for most people with primary open angle glaucoma, they develop pressures in the mid-20s or high 20s or low 30s. Those can be treated almost always with medications, laser, or surgery. Glaucoma does not mean you're going to go blind because there are treatments available. But if people don't follow the recommendation of their eye care providers, they will slowly lose vision from glaucoma, and that vision cannot be regained. So it's very important that you take this disease seriously and follow your eye care provider's recommendations. Thank you.